In the middle of an emergency, when every second is critical, the last thing you need to be second-guessing is the law. This is your guide to acting decisively and legally when a patient simply can't give you consent.
We've all been there, right? A patient is crashing, there's no family anywhere to be found, and the clock is ticking against you. The question is, what can you legally do? Let's walk through this so you know you're protected while you do your job.
So, first things first, we have to be crystal clear on what actually constitutes an emergency in the eyes of the law. You see, this isn't just a medical definition, it's a legal one, and your actions will be judged by.
The keywords you really need to lock onto here are imminent threat and severe harm. The law gets it. It understands that in these moments, your duty to save a life has to take priority over standard procedure.
Look, if you can check any of these boxes, especially that last one where the patient is unable to consent, you are on solid legal ground to act. This isn't some gray area. It's a clearly defined pathway for you to provide life-saving care.
Okay, so you've established that it's a true legal emergency. Now what? Well, this is where your most powerful tool comes into play. Implied consent. But what does that really mean? Let's break it down.
See, this isn't you just making a guess or an assumption. This is a solid legal principle. The law presumes that any reasonable person would want you to save their life. In that moment, you're not just a doctor. You're acting on that person's presumed will.
And this isn't some new or untested idea, not at all. Implied consent is built on a rock-solid foundation of medical ethics, legal necessity, and tons of case law. It's recognized by medical bodies all over the world. You are standing on very firm ground here.
But, and this is a really important but, you have to remember that implied consent is like a scalpel, not a sledgehammer. It is for one specific, life-threatening situation. It is not a free pass to do whatever you think is best.
So where is that line? What's in bounds and what's out of bounds? Let's get really specific about this.
On the left, you see the clear, life-saving stuff. Airway management, stopping a major bleed, stabilizing a fracture, these are absolutely covered. But on the right, these are the things that fall outside its scope. Anything elective, cosmetic, or just not directly related to the immediate threat is off limits. The rule of thumb is simple: stick to what is absolutely essential right now.
Now, we need to talk about what happens when the patient is conscious and they say no. This is where things can get very tricky, and you need to be prepared.
I know this can be a hard pill to swallow, but it is the absolute law. A competent patient's right to make their own decisions, their autonomy, trumps everything else, even your duty to save their life.
So if a patient is awake and refusing care, your very first step is to assess their capacity to make that decision. If they have capacity, you absolutely must stop. Implied consent is off the table. Your duty then shifts from treatment to meticulously documenting their refusal and your assessment. And that brings us to what might be the most crucial part of this entire discussion, your documentation. This isn't just about keeping records, okay? This is about protecting yourself.
I really want this to sink in. Your notes are not just a list of events. They are your justification. They need to transport any person reading them, a lawyer, a judge, another doctor, back to that exact moment and make them understand why you did what you did.
So, here it is. Your 6-step checklist for ironclad documentation. 1. The patient's condition on arrival. 2. Exactly why you couldn't get consent. 3. Every attempt you made to contact family. 4. What you did and why it was necessary. 5. Who was there with you. And 6. The conversation you had with the family afterwards. Don't miss a single step.
And what about kids? It's straightforward, really. The exact same rules apply. If a child is in immediate danger and a guardian isn't there, you don't just have the right to act, you have a clear duty to act.
In those difficult medical legal cases, the ones that might involve criminal activity, remember your priority. Your absolute #1 duty is to the patient. Stabilize them, save their life. The legal formalities like involving the police must come after, never before.
So, I'll leave you with a question. The next time you have a minute, pull up the notes from your last really critical case. Ask yourself, would they stand up in court? Would they serve as your shield? Because your medical skills save lives, but it's your documentation that will save your career.
Your med lawyer, protecting doctors, empowering patients.